Hey there guys, what is up and welcome back to my channel. So today you guys, I hope I don't have lipstick on my teeth, and if I do I'm so sorry. But today you guys, I'm going to be doing a 19 and 20 week update. You guys, I am now 22 weeks, so just bear with me. I think I'm probably at this point I've been doing 2-week updates prepared, so on Wednesday I'll probably film my 21 and 22 week update. Y'all, this has just been a mess. But I'm gonna go on ahead and talk to you guys about how I was feeling in weeks 19 and 20. I'm not gonna really cover like how big was the baby and this and that, because of the fact that I feel like if you're pregnant, you got all the apps too and you're downloading all the apps. I will just go on ahead and show you guys what apps I am using. So I do use What to Expect, the Baby Center, Ovia Pregnancy, and Pregnancy Plus, and I kind of just skim through and see what articles I like and read them. And I like to do Pregnancy Plus more for visuals, and I just kind of do it on there. Each app I use it for a different reason and for a different purpose, so I really like it. I also have a pregnancy journal that I actually need to work on filling out. You guys have seen this before in the past, but I like to keep my ultrasound photos in here because I feel like they're safe, the ones that I haven't used. And I actually started this journal before whenever I had my miscarriage in my last pregnancy, and it's just been special to kind of, you know, use it from my last pregnancy and then use it in this pregnancy. So I'm really excited for that, but I do need to update a lot of stuff about how I'm feeling and what I'm going through, because of the fact that I just need to update it all. But what I do like about this journal that I'm going to show you is it does have like how your baby grows in each section. So right now we're in second trimester, so I'll go on ahead and read week 19 and 20 just for the fun of it. So the vernix, a thick white greasy substance, is being secreted by glands in your baby's skin to protect it from being waterlogged in the amniotic fluid. So that's super cool in week 19. And then week 20, if your baby is a girl, her ovaries now contain around 2 million eggs. This will reduce to 1 million by the time she's born. So I wonder if she's already like ovulating her little eggs. But so week 19 and 20 were really okay weeks for me. They were a little bit rough, you know. My schedule has been crazy. It's just been crazy, but they have been better. I have gotten onto medication for heartburn. I'm taking the omeprazole, I think that's what it's called. I asked them if I could get something prescribed because Tums were not working, and I have been trying to clean out my diet. I noticed that I have dived back into cravings like 3 times with like foods that I probably shouldn't be eating, just because of the fact that I'm taking the meds. So it's kind of has allowed me to eat what I wanted to in those times, but I do still suffer with heartburn. So what the omeprazole does is it kind of prevents any further acid reflux to develop, any new acid reflux, or any new acid, any new acid in your stomach. It prevents that from like developing, but it does not like fully eliminate your acid. It can bring a little bit of relief, but it does not fully eliminate the acid that you already have. So I have still been taking Tums daily. I did get recommended another over-the-counter medicine called, I think it was called like Maalox or something weird like that. Let me know if you guys have tried it. It's like a liquid form of Tums, and I hear that one's better. So I don't really quite know like which one to do, but you guys will just go on ahead and I guess work it out with me. But so as far as the heartburn, the esophagus spasms, I have not had any more esophagus spasms. Sometimes I do feel like tightness of chest a little bit here and there, and that could just be with honestly eating like just about anything at this point. But my heartburn has been getting a little bit better. I do experience it still on the daily, but it's not like as severe as what I was experiencing as it's not as severe as how I was experiencing it before taking the meds, but I am feeling a lot better. Back pain is still like in the middle. If I'm really active, I do notice that like I kind of want to cramp like in my butt and my back hurts. I notice my legs have been very crampy like throughout week 19 and 20. Just kind of like I noticed in week 19 and 20 I was starting to feel like more like pregnant, like bigger pregnant in a way. So yes, I was starting to feel more like weight like down. I feel like all the other weeks like I kind of felt pregnant, but like I feel like now I'm really starting to feel like pregnant, and so I'm just like, I don't know. I don't know if that makes any sense. But also in week 19 to 20 I did start to experience more baby movement, and I was feeling the baby. Now let me tell you guys how I was feeling it. I was feeling like baby movement kind of like in my pelvis area. Like I don't know how else to describe it to where it's not like too graphic, but it kind of had felt like if she was like moving like similar, like if she wanted to come out of my privates. Like that's how it feels like whenever she moves. Now it's kind of switching, but I'll update you guys on that later. But like in week 19 and 20, any movement that I felt from her, it was felt like almost like she wanted to come out of my privates, but like she was like moving in my privates. And so from the ultrasound that I did take, because I'm going to tell you guys about my anatomy scan, she was like upside down in there. So like she was straight up. So like her head was like in my pelvis and her feet were like up where my belly button was at. So she was just like straightly stretched and just like, I don't know, I guess comfortable or whatever. But I wonder if it's like her head or whatever that I'm feeling. But so anyways, you guys, like, yeah, so I have been experiencing a lot of baby movement. Sometimes I'll feel it like a little bit in my stomach. Well, I'm talking about week 19 to 20. Now I feel it very different, but like sometimes I would feel it like in my stomach, but it was more, I felt more movement like kind of like in my pelvic region. It felt like if she was like, it feels kind of like popping feelings. It's kind of really weird, but yes. So let me go on ahead and pull out my anatomy ultrasound photos. I have, they're so cute. So here, right here is this little picture. I do love that now the picture is way more clear. She still has not developed too much fat yet in these pictures, so we're just trying to figure it out. Again, in the anatomy scan, they did confirm that she is a girl. So if you guys do not know, I did go and get my gender confirmation at 14 weeks at an outpatient, like an out ultrasound place. There are my anatomy scan ultrasound things. So as far as anatomy scan had went, it was a kind of long ultrasound, but you guys, they scanned like everything. Like talking about an anatomy scan, they really just checked every last thing in her body, and they were measuring everything and looking at everything. She was so shy. For every single ultrasound, she's always been shy and never in the position that she needs to be in. But and she's always been like knocked out of sleep at every single ultrasound. She's like knocked out. She's not waking up. She's asleep. I do notice that like as far as week 19 and 20, I think that now their sleep patterns by then are beginning to develop a little bit better. But they're still sleeping like a long amounts of the daytime, but they're kind of getting more of like a little pattern going. And in those weeks, like, and up till even now, I noticed that her most favorite time to be awake and kicking is in between 11 and 12 in the night. So I'm just like, girlfriend, this is too much. But it's been really fun. But they measured every last thing in her body. She's doing pretty good. I did get they did tell me that her kidneys, her little, I think that they said like her right pelvic kidney, whatever that might mean, but they did say that it is measuring just a little bit smaller. Like, I don't know if just a little bit or a lot. All that I know is that they told me that it was abnormal on the scan, but that they said that everything else looks pretty good and that they're just going to be monitoring her little growth on her kidneys and on the rest of her body from this point on. So she was measuring small, now she's measuring just at normal, but the only thing that's abnormal is just the kidney measurement, that right kidney. So, but honestly, you guys, I'm not even worried about hearing about that because I know that I serve an awesome God, and I know that God's gonna keep my baby healthy and he's gonna keep her good. And I'm just so blessed to know that like my baby is alive in my stomach this far on, because it's just been really weird, okay, to experience pregnancy, but it's been even weirder just to know that she's like still alive in there. But that's how the anatomy scan had went. Apart from that, she did a transvaginal thing to make sure my cervix was looking okay, and then apart from that, again, just measured every single last thing. It was so cute though to see just how the body works, you guys. I have taken anatomy courses in the past, and I've taken, you know, just classes like that, and I've always been so in awe. But to see it all in like the womb in such a short amount of time, that your baby can go from a cell to like a thing with like bones and all kinds of stuff, it's just like, it's like, I mean, I'm not bashing on anybody, but it's like there's just no way to not believe that there is a God. Yes, science is real, I do believe in science, but there's just no way to believe that like someone, like, this was not just designed by like somebody, okay? So it's just really cool to see it, to see the baby grow, and to see just her body the way that it is. So it's been really beautiful to see it. Apart from that, everything's been pretty good, you guys. Cravings, if I'm gonna jump into Cravings, I'm actually munching on one right now. I've been obsessed with the oatmeal cream pies. I just like love their filling, and I just love the way that they taste. I noticed that these do give me like heartburn though, so I have to really be careful. But oatmeal cream pies have been my most favorite pregnancy snack. I feel like, an ice cream. Oatmeal cream pies and ice cream are like my jam this past month. So that's what I've been munching on. Okay. I think that that's pretty much it for the update. But let me go on ahead and show you guys a bump date. You guys are gonna see a 22-week bump date, but that's okay, because of the fact that either way, the next time that you guys see a bump date, I'm gonna be even further along. So I'm just gonna go on ahead and show you guys right now. So here is, should I turn on the light? Will that help? Okay, so here is how we are looking from the front, you guys. I do notice that I am growing. I feel like if I need to start buying maternity clothes, but here is how we are looking from the side. I'm gonna pull up my top because I feel like I'm wearing these pants again, you guys. I wear these pants like in every single pregnancy update, but right now, you guys, these are the only, I'm like washing these pants, like I kid you not, like 2 times a week, because they're the only pants that fit me comfortably, apart from some other leggings. I think it's time to start shopping in the maternity section. But I am still losing weight, you guys. Like, I'm still underneath my weight from from first checkup and pregnancy. I'm still underneath my weight, so I'm still losing weight, which is weird, but I feel like so much fatter, which is weird. But this is the side of my stomach. It is starting to now feel hard, like on the sides. If I pull down like my pants a little bit more, I'll show you guys. I'm just starting to like just get more, I feel like, pregnant-y looking. Still with like the top over, you can't really tell. I feel like if I just look like a chunky girl, but like me and myself, I can tell that I'm like looking more pregnant. Here's from this side. You guys, I have a lot of back fat, so just ignore all my back fat. But I just feel like if I'm starting to look more pregnant. Again, you guys have seen her room. I did pick up a new rug, so here's a sneak peek into a pregnancy haul that's going to be coming up. I've already been getting more stuff for the baby. Baby shower is going to be in May, but I'm still getting little knickknacks from her, and I found this rug for $26, so I was like, I just have to get it, and it's so cute. So baby room is coming along. Again, you guys, I'm going to be filming more baby hauls, but her clothes is starting to come along more. And I can't be like more excited for her to be here. So that is it, you guys, for this pregnancy update. I hope that you guys did enjoy this video, and I will see you guys on the next pregnancy update. I love you guys. Bye.